Importance of disease surveillance and predictive health modeling for disease prevention and control. The importance of building health predictive models and disease surveillance for prevention and control of epidemics. The world has witnessed the devastating effects of epidemics on human health and economic stability. The recent COVID-19 pandemic is a stark reminder of the importance of building health predictive models and disease surveillance systems to prevent and control the spread of infectious diseases. These tools can help healthcare professionals and policymakers make informed decisions about prevention and treatment strategies. Health predictive models are statistical algorithms that use patient data to predict the likelihood of developing a particular disease. These models can help healthcare providers identify patients who are at high risk of developing certain conditions, such as diabetes, heart disease, or cancer. By identifying high-risk patients early, healthcare providers can develop personalized prevention and treatment plans to improve patient outcomes. In addition to health predictive models, disease surveillance systems are critical for early detection and control of infectious diseases. These systems monitor public health data, including disease incidence, mortality rates, and vaccination coverage, to identify outbreaks and track the spread of diseases. By identifying outbreaks early, public health officials can implement control measures to prevent further spread of the disease. The benefits of health predictive models and disease surveillance systems extend beyond individual patient care and public health. These tools can also inform policy decisions related to healthcare resource allocation and disease prevention. For example, predictive models can help policymakers understand the potential impact of different healthcare policies and interventions on population health outcomes. Disease surveillance systems can also help policymakers allocate resources to areas that are most at risk for disease outbreaks. Despite the clear benefits of health predictive models and disease surveillance systems, there are still significant challenges to their implementation. These challenges include data privacy concerns, data quality issues, and the need for specialized expertise to develop and maintain these tools. However, investments in these tools are essential for improving public health outcomes and reducing the economic impact of epidemics. There are several approaches to building health predictive models and disease surveillance systems. One approach is to use machine learning algorithms to analyze large datasets of patient health information to identify patterns and predict disease outcomes. Another approach is to incorporate wearable devices and other digital health technologies to collect real-time data on patient health. In addition to these technological approaches, it is also important to address social determinants of health, such as poverty, education, and access to health care. These factors can have a significant impact on health outcomes and must be considered in the development of health predictive models and disease surveillance systems. Moreover, it is crucial to ensure that health predictive models and disease surveillance systems are developed and implemented in an ethical and responsible manner. This includes ensuring patient privacy, data security, and transparency in the use of these tools. It also requires engaging diverse stakeholders, including patients, healthcare providers, policymakers, and community organizations, in the development and implementation of these tools. Looking to the future, the development and integration of health predictive models and disease surveillance systems will continue to play a critical role in preventing and controlling epidemics. The ongoing COVID-19 pandemic has highlighted the need for more robust and effective disease surveillance systems and the importance of investing in public health infrastructure. By leveraging new technologies and addressing social determinants of health, we can build more effective and equitable health systems that can respond to emerging epidemics and improve overall health outcomes.